When combining movement of the hip joint with the upper spine, we need to be wary of issues around the right hand side, especially when you have a disc injury on this right hand side. But the combination of upper back movement along with the hip motion really assists with the overall function of our bodies. So let's say, for example, we put all the weight on the right leg here, and we're improving this right hip mobility and rotation. What we can do is start to couple the motion, as long as there aren't restrictions in the upper spine, to couple the motions with the leg in flexion or rotation. So as an example to this, we might be able to take this right hand, rotate it around the corner as you get down into this single leg squat, if you like, into the hip joint. Then we can combine that with a same side reach over to that side to really get the spine going at the same time, so nice and long reaches. Opposite to that, you then got your opposite side bending. Now of course, if you've got a disc injury on this side bending this way can aggravate it. But if you stay nice and tall, you should get your upper thoracic spine involved. So for the next one, it's rotation around the corner here. And then as you feel okay, you're going to then take the top hand over the top, over to the other side. Now we can combine these into a little bit of extension and a little bit of flexion. So for the one I've just done here, we've got the rotations going this way. We can get the rotations going slightly more upwards, so you get some extension through the spine at the same time. So we get a slightly upward reach as we come through, slightly upward reach as we come through. And that's the one you have to be a bit wary of the next one, because we're going to add flexion, and flexion is the one that can cause an issue. So this is the last movement you want to do, and test it out and see how you are. Not very many, just a few to see how things are. So the next one is going slightly more into flexion, so we're going to slowly reach down and up at the same time. And here, if you want to change up the motion, if you want to stop yourself from flexing too much, you can sit into it a little bit more. So you're sitting into the motion rather than flexing forward, which would then aggravate that disc injury. You can do the same thing with the other one, which is rotating this way, and then obviously side bending across, but now you can add a bit of extension, so you get a bit taller, you can see I'm always driving my knee forward, or you can get slightly lower through that motion. If you're a racket sports type of person, the right hand here, where you're playing or hitting something, is where you need to get low and you need to get high. So it's a really good opportunity to get round your body over this hip. So you can do exactly the same thing on the opposite side. And if you do have those right-sided disc injuries, where you want to be wary of here is the rotation this way, but do test it out. And of course the side bending this way. So when you do this motion, that's where you want to be a little bit more upright, keep your body nice and tall because you're opening this space up. And of course when you do this motion, you also want to be a little bit more careful of where this hand is reaching. Too much flexion and too much side bending can aggravate this area. Usually, if you've had a disc injury over a long period of time, by then the disc would have been dehydrated and slightly worn down, which makes it less likely to have more of a slippage and more of an issue. So this is where you can create upper spine motion along with your hip mobility. You then can change this up and start to address as a progression into different angles. So instead of having the foot forward, you could have the foot over to the side all the way through there. And again, the same activity there, same activity there. And the same thing on this side, same activity there and there. So you're really opening the spine up. These are the progressions to this. And of course, you then got rotation, so you can go in rotation here in this position, and then same thing, and of course rotation this way, same thing. But at this point, we're really driving the body into different planes of motion. So just a side note, before you go on to those 3 directions, you may want to challenge yourself with just doing lunges in those 3 different planes of motion to be able to see how well your body takes that momentum and that movement before you get into these overall thoracic spine mobility exercises. So these are specific for racket sports, tennis, badminton, those kind of things, and squash as well. And you can add some weight into this, so you're adding weight at different points that will enable you to get the abdominal muscles working at the same time.